Good evening. I'm Dr. John Bergman for another Common Sense Healthcare Minute. Tonight we're going to talk about blood pressure, specifically high blood pressure. Now, there's a number bannered around in cookie-cutter medicine today, and that's usually 120/80. That means one number is right for everybody in any circumstance. That doesn't make a lot of sense. Now I'm going to talk about two conditions that could elevate blood pressure in a body's natural response to that type of compression. First off, let's look at what normal is. Normal, when you're sitting on the side, the ear should be over the shoulder. If you have a normal curve in the neck, that's a beautiful 45-degree curve, the top is placed over the base. Now let's say that you've had some type of trauma, throwing that head forward. Now that would be a whiplash trauma. Now do me a favor, sit up nice and straight. Throw the head forward. Now, leaving the head forward, take a deep breath. Now, reposition just the head. Now take a deep breath. It's quite a bit easier, isn't it? Well, what happens is, if that head's forward, there's two things that can happen. First, you can compress or impinge the anterior aspect of the chest. Now, your chest has to move up and down every time you take a deep breath. Also, you can have a neurologic compression. The cardiac and respiratory centers located at the base of the brain can be compressed if that head's been thrown forward. Now, let's look at this case here. What you're looking at here is a reverse curve in the neck. That means that this patient here had a trauma tearing a ligament called a posterior longitudinal ligament in the neck. Now, in a normal neck, each bone should be the same shape. Look at these. That bone is crushed and rotted. This means that this neck has had long-term damage. That means that this person's been in pain for years. Here is the patient afterwards. Look at this. Starting to get the curve back and restored, but what I want you to see is this joint here is beginning to open. What you're seeing there is not only a change of force loading which caused the degeneration, but we're reversing the degeneration in that patient, as well as reducing the pain, as well as repositioning the head. Now let's talk about that. Under pain, any type of pain, I don't care if you hit your thumb with a hammer, I don't care if you've been in a trauma and a whiplash accident, your body goes into what's called a sympathetic dominant response. That's the fight or flight response. Now, if in a fight or flight, the first thing that you do is your heart rate elevates. That heart rate elevates in order to get away from danger. So any type of pain will cause an elevation in blood pressure. Now, if you have, let's say, a mechanical distortion of the chest, let's say you're sitting up nice and straight, let's say you've had a football injury, or car accident, or fall off of a ladder. Now slide off to the side and take a deep breath. Now go back to the middle, take a deep breath. Wow, it's a lot easier sitting up straight, isn't it? Now, let's look at the body. It's brilliant. Again, it's designed by God. If you have a mechanical distortion, that heart has to work harder to get oxygen to the brain, yes or yes. If you give that patient a beta blocker or a diuretic or some type of medication to slow that person's heart rate down, do you make them healthier or sicker? I'll tell you right now, you're making that person sicker. Let's look at this case here. This person, multiple football injuries, multiple traumas, and look at the distortion of there. This person is not completely off to the side. Now this person had to, in a brilliant, natural, normal body response to this type of trauma, that heart has to elevate blood pressure to get oxygen into the brain. Here's the person afterwards. Now this is 90 days into care. We've corrected the mechanical distortion. So what happened to that person's blood pressure? It normalized. It went down to normal. Now, I'm Dr. John Bergman for Common Sense in Healthcare. If you need medications, take them. But if you're taking medications without knowing the cause of why you have high blood pressure, that's doing you a major detriment. God bless.